And so we wanted to just take some time to talk to an expert in the field of particularly one that's in our own backyard. We are so delighted to have Dr. Gunn, and she's going to do her very best to answer questions. I want to say that there's a whole lot we don't know about this virus, and so we want to make sure that whatever questions that we get answered, that we can make sure that we allow for Dr. Gunn to answer them as she can, but also understand that there's just a lot that a lot of us don't know, particularly even those in the profession. So first and foremost, Dr. Gunn, can you just tell us, how are you doing? You are on the front lines of this thing. Can you let us know, how are you handling all of that's coming at you? How are you doing? Is Dr. Gunn there?
I don't know if a call came in. I can see her name here.
Yeah. Well, here's what we can do. If you all have questions, can you start sending them via the chat? That way we can begin to compile questions and go from there. And what we'll do is we'll have her give us a quick intro about how this thing is affecting particularly our community, and then begin to answer your questions. I have a few right here, but I'll make sure we'll begin to have your questions answered as soon as we can get connected to Dr. Gunn. Dr. Gunn, are you around yet?
Text her.
Okay. Just as Ms. Dooley said, for those of you who are coming in, this is being recorded. So if you don't want to have your face displayed for all to see, make sure that you turn off your camera. Otherwise, we're going to upload this recorded version onto our website after we're done with this session tonight. Hey, Dr. Gunn, how are you?
Okay.
Okay.
I heard some static, and I wasn't sure if it was me or the other person or what was going on.
Okay.
All right. Can you hear me or see me?
We can hear you. We can hear you.
Okay. All right. And I got the screen up with the questions too.
Okay, perfect. Well, the first question I wanted to ask you is just, how are you doing? How are you handling being on the front line of this thing? And how are you feeling these days?
Well, I am a little stressed, but I'm optimistic. I think that as a healthcare professional, like most people, you just get out there and do what you've been trained all your life to do. I think just making sure that we take precaution, making sure that my nurses have access to the appropriate amount of PPE, which we do right now. So that's not an issue for us.
Good.
But we, our hospital administration has put a lot of coping mechanisms and help for nurses and staff in place so that when we're stressed, we have someone to talk to. So it's definitely an experience. I won't say it's not, and I have my days, some better than most, but most of my days, as my grandmother always say, I won't complain. Most of my days are good days.
There you go. There you go. Thank you so much for that. And I think you addressed an important part that I hope we get a chance to talk through, is the mental health side of this as well. So maybe later on we can talk through that as well. Let's start with terms. We hear COVID-19, we hear coronavirus, we hear corona, we hear Rona. What is the appropriate way? How are you all referring to this thing in the hospitals?
Well, there's always the scientific community that pronounces things a lot differently. I think COVID-19 is still appropriate. That's what we're all using. We're actually, in the field of medicine, we've kind of shortened the term. And most of the coding that we do, like diagnosis coding, is COVID-19 is very appropriate. So that's a very appropriate word. It's easy for people to remember.
Okay.
But the term is derived from the coronavirus. And what I want everyone to understand is a little scientific background. So coronaviruses are very common in the community. It's the virus that causes the common cold. So there's like hundreds of versions of coronaviruses. Now, most of the coronaviruses that we've become aware of, we've kind of evolved with them as human beings. We've been around for tens of thousands of years, and the coronaviruses that normally infect humans have been around for tens of thousands of years. And we kind of have this on and off symbiotic relationship. And the only time it ever bothers us, it would give us a runny nose or cold, but we don't die from it. Okay?
Mm-hmm.
Now, what people need to understand is coronavirus is also there's subspecies or subtypes of the virus that live specifically in certain animals. There's some that are very specific to the bat, some that are very specific to other animals that are in the wild that humans usually don't come into contact with in our normal course of living on this planet. I think what happened, whatever theory you want to believe in China, but somehow an animal form of the coronavirus from the bat species came into contact with the human population. And normally it doesn't do anything. It just dies out because it's not used to the human species. But this particular type of coronavirus infected a human being. And usually once it infects a human being, there's not normally a human-to-human transfer. So it'll infect that one person, but then it just stops. It just dies there. But this virus was very unique in that it was able to mutate enough to be able to be spread from human to human. That's why you have sustained infection throughout a community. And what was unnerving to the scientific community or very disconcerting to us is that this virus is a new coronavirus. Not any human being on the planet, no matter who you are, where you're from, has an immune system that could deal with this virus because it's literally brand new.
So when we see the COVID-19, this is year 2019, is that correct?
Right. They name it 2019 because that's the year it occurred, 2019, in the fall or winter of 2019. Depending on which reports you want to believe out of China, it could be as early as end of November, early December it was around. It was definitely in this country, we believe, as early as late January, early February. But it started in 2019. That's why we call it COVID-19.
Gotcha. Can you talk through symptoms? We hear a lot about symptoms these days and what should we be looking out for. What are some of the symptoms of this disease or this virus?
Some of the cardinal symptoms, the ones you hear about all the time, are the fever and the cough and the difficulty breathing. But we also notice that there are other symptoms that, because it's new, we're learning. So there are other symptoms that a lot of people report. Everything from general body aches to fatigue and malaise. Some people get headaches or sinus-like infections. Some people simply get a runny nose, a little bit of cough, but a lot of people, what we're finding out, a lot of them is finding that they're losing their sense of taste or smell at the same time. And it's very interesting because the way the virus is transmitted is what we call nasopharyngeal, meaning if someone coughs on you or you breathe the air of someone that's contaminated, you can literally breathe those viruses or viral cells into your nose or mouth or come into contact with your face or eye, it gets in the body that way.
Wow. So then that leads me to my question of masks and how do we protect ourselves as we're walking out, going to the store or various places? What are the forms of protection that we should be exploring at this point?
Well, the first thing, when you want to protect yourself, the first thing you need to know is how does it spread? I can protect myself if I know how it spreads. We know it's nasopharyngeal, meaning you can breathe it in if you're breathing the same air as a contaminated person. So the mask is important. That protects your nose and your mouth, okay? So that's why the mask. There's another way that is transmitted, though, and we call those fomites. But just to be more technical, let's say I cough, okay, and I don't have a handkerchief. I'm infected and I cough in my hand. Or a kid sneezes like all kids do with runny noses, or they touch part of their body. And then they touch a doorknob, or they touch a can of something on a shelf, or they touch a steering wheel or a door. The virus lives on these surfaces. So if you come right behind the person and touch that same door or that same doorknob, and then you touch your face, you're actually infected. So that's why you see us doing constant hand washing, telling people to wash their hands, or if you don't have it, the hand sanitizer is very, very important. But it's also why a lot of times in the school districts, a lot of the health advisors say you've got to close the schools because children are naturally children. They are not going to be diligent at not wiping their nose with their back of their hand or their arm and touching the doorknob to go in and out of a classroom and then spreading it that way. So that was one of the things that's concerning. So making sure careful hand washing, sanitizing. That's why you see a lot of people cleaning areas. So when you get ready to go out into the world, let's say you're in your house and your house is fine and you're okay, well, you need to go to the store. When you go out into the community, you put on your mask. You don't always have to have gloves, and sometimes people don't use gloves the right way, so we don't advertise to use gloves. But what you do need to do is at least have a little hand sanitizer, or be conscious. If you go out and you're getting your groceries, okay, when you get home, make sure you thoroughly wash your hands and wipe down surface areas that you've touched in your car and things like that immediately as soon as you get in your home.
Can you talk about groceries then, since you just mentioned the grocery store? Do we wipe down our groceries? Does it include cardboard and veggies and all that stuff? How should we handle groceries?
Well, as far as groceries is concerned, it actually, first of all, in the supermarket, we have a fruit and vegetable aisle. And for some reason, a lot of people like to touch their fruit and vegetables before they buy it. So they touch it, pick it, pull it, put one back. And that's just in everyday life, whether we're in coronavirus or not. You should always wash your vegetables and fruits when you get home from a supermarket, and even more so today because that's it could be a source of contamination. We find that the virus really likes to live on things that are hard surfaces like plastic, aluminum, anything shiny, not necessarily porous. So it can survive on cardboard or paper for maybe a little while, but not very long. But it can survive on a piece of plastic or aluminum foil or something shiny and hard a little longer. So let's say I buy a can of soup. I would, wipe the can of soup down. It's okay to wipe the containers of food that you buy on the outside, just a general wiping, okay?
Okay.
And then, of course, wash your hands. And that's actually what we do in my family. Just a general wiping. You don't need to dump them in some, go all out. Just a general wiping of canned goods and things like that, and washing vegetables and fruits that you can just rinse them off. The good news about this virus is it is absolutely destroyed with plain soap and water. You don't even believe, just plain soap and water destroys the virus. So, making sure you thoroughly wash your hands. That's why that 20 seconds, right, that happy birthday song is so important, because it takes that long to thoroughly get the soap into your hands and between your hands and then under your nails and things like that.
Can we go back to the mask? A question that's
Sure.
coming in about, do you need to wear a mask? First off, what type of mask? And then do you need to wear a mask when you are walking around in the neighborhood in open air, when no one else is walking around, or in your backyard? When do we wear a mask?
What I would recommend is this. If you're going to leave the house and go where there are other people, like a supermarket, you need to be in the building and you're going to need to stand in line. You're going to try and stay 6 feet away, but you're going to be in a situation where you may come into contact with other people, then you need to wear a mask. If you're in a situation where you're going to go out, let's say you live in a neighborhood where there's a park and there's really no one in the park, and you want to just walk out and get some fresh air, as long as you're not coming into any significant contact with another human being other than the people you live with, you should be okay. But for the most part, anytime you go into an enclosed structure, any building, gas station, store, supermarket, where there's the potential for other people to be in to cough or you to share the air with them, I would definitely put on a mask. Okay.
We had a question about hand sanitizer. What if the hand sanitizer is not 70% alcohol? For instance, there are some that are 68%. Does this make a difference? And can you tell us a bit more about hand sanitizers?
Yeah, hand sanitizers has become very unique. Now, some people have a 70% isopropyl alcohol, which is the basic alcohol we used to always just buy off the counter shelf. And some people have 68%. There are a couple of studies out that as long as the majority of it is above 55% alcohol, it should be able to kill the germs. Now, you do have some nefarious individuals out here who are selling hand sanitizers with a very small amount of alcohol, and I don't recommend that. As you know, a lot of people have recommended between 60 and 70% alcohol content if you can get it that way. And by the way, hand sanitizer is nothing but rubbing alcohol, and aloe vera, and they use the aloe vera so you can get it on your hands. Now, some people add a little fragrance to it or whatever, but that's basically all it is.
Huh, okay. Can you tell us a little bit about how this is affecting particularly the African-American community? We hear a lot about this being ravenous, particularly when it comes to folks on the lower socioeconomic side of things, but also particularly the African-American community. Can you talk specifically to that for us?
Yes, I can. Not only the African American community in general in the United States, but how about we focus a little bit on St. Louis City and St. Louis County too.
Okay. Beautiful.
So when you look at the numbers, okay, we are at in the United States in general, we're at right at about 1 million infected and over 50,000 deaths. And the African American population at best is only representing somewhere between 12 to 13% of the U.S. population. But but almost half of the deaths are people of color, African American or Hispanic. Okay. So what we're finding is that people who are more prone to have poor outcomes or increased morbidity or death rates are people with comorbid disease, obesity, who don't have necessarily resources to access medical care immediately. And those are the vulnerable population. And so this is where the socio determinants of health come into play and are absolutely critical. It is no mystery that African Americans and people of color suffer higher incidence of hypertension, higher incidence of cardiac disease, higher incidence of diabetes, and things like that. Unfortunately, this particular virus wreaks havoc on the immune system. Your immune system is already challenged with those chronic diseases. So it's like a double whammy. The other thing that's hurting us in the social determinants is what we used to thrive on in our communities in order to survive was the community being able to come together, multi-generations being in one home. So our homes tend to be a little bit more full. So you may have a mom with 3 kids living with her grandma or great-grandma all in one family. And so you have space, it's just not a whole lot of space. And also for brown families, that is the same situation. But when you do that, you can transmit disease a lot faster, a lot easier because you don't have a whole lot of social distancing within the house. Let me give you an example. You may have a situation where a young person gets diagnosed with COVID-19, a young African-American female, and the doctor sends her home. She's doing well. She can recover to shelter at home. But if she goes home, she lives in the home with 6 other people: her mother, her father, her grandmother, her baby daughter, her brother, and maybe a cousin or 2. And it's a 3 or 4 bedroom house. So there's not an area of the house that she can go into where it's only her and she not be able to get to the bathroom or interact with other people. And so then the other people become at risk for catching the disease because it's really very, very difficult to isolate in place in a situation like that. Or if she is the one main caregiver and the one and only breadwinner of the family, it puts her at risk. So let's say, for example, this is the one who needs to go out and work to make sure income is coming in, but her job is considered essential. She may be a housekeeper at the local hospital, so her job is to clean the COVID rooms when the patients either discharge home or go to another part of the hospital. And that puts that person at risk, and she has to go in and out of that environment constantly, and then not having the resources to be able to shelter in a different place because she can't afford to, or get the things that she needs to make sure that she keeps her family safe. Mm. So these are compacting, and they're hitting us hard. In the state of Missouri, we have several thousand cases. When you look at the total number of COVID, and I can't remember what I saw. I saw it up this morning. I think every day, today is Wednesday, which means they should have done a count at about an hour ago. But we just recently had the largest #1 jump in cases in the last 3 days. Wow. And what you got to understand about the state of Missouri is the majority of those cases are in the metropolitan St. Louis area, and in the metropolitan St. Louis area, the majority of those cases and deaths are between St. Louis City and St. Louis County. I'm sure you're aware about a week and a half ago when the city health department announced that its initial 14 deaths, all 14 of them were African American. 100% of all of their deaths were people of color.
So then the initial myths that were Black folks were immune from this, or that this is for a virus that only the elderly are getting, those are starting to look very different now that we're on, in approaching May. Can you talk a little bit about those myths
Yeah, sure. That's exactly what they were, myths. The myth that black people can't get this. Well, what you were doing is you were watching the disease as it traveled. The disease came from China, and diseases, now that we have airplanes, travel very fast. It came to China, and you saw it go to the East Coast and the West Coast pretty quickly. Well, obviously, those people are people who interact or do things at a business level, so they had business in China. They came home with the virus. They infected their communities first, or began to have infection in their communities, and that's where their people began. But when you have communities spread that way, the people at the front of the line, the people who clean the hotel room behind the men that was coming, the people who go on the airplane and have to clean the airplane after people get off, these are your service industry people. They take that virus home with them. And so it was nothing, the spread that it only affects older people, it does not affect African Americans, were all myths. It was just all, and it still is. It's just a myth, and it shouldn't be given any air. It is not true. All you got to do is look at the numbers. It's killing us faster than anybody else.
Wow. We have 2 questions that have come in, and if you all have questions, please continue to add them into the chat section. One says, so after taking all of the precautions like constantly washing hands, masks, hand sanitizer, and limited contact with people, what happens in the long run to our immune system when our system doesn't have contact with any germs or bacteria? Doesn't our immune system get built up by some limited exposure to germs?
Yeah. Over time, you're going to get exposed to germs, and that's what tests your immune system and makes it stronger. With all the hand washing you're doing and all the things that we're doing, believe me, we are not eliminating all the germs. You're still being bombarded with millions of germs each day. You're just not realizing that you are. But that's okay. That's part of human development in nature. The reason we're doing this with this particular one is because we know the type of virus it is and we know how it spreads. Now, one thing that people aren't realizing is one way you cannot get coronavirus is in the food that you eat. Have you noticed that?
Mm-hmm.
So let's say somebody, there's certain things that are foodborne illnesses, okay? Coronavirus is not a foodborne illness. You can't get it from eating a hamburger that somebody gave you at a drive-thru. You can't get it that way. Now, you can get 5 other bacteria. You can still get food poisoning. You can wash your hands all day long. You can still get food poisoning. So believe me, no matter what you're doing, you're still being bombarded with microbes every day. It's just that these are microbes that we have evolved with over time, and they have evolved with us, so our immune system knows how to deal with them.
So Ms. Kim can still bake me goodies then, and I won't get the coronavirus.
Only if she coughs on you.
Another question is about reinfection. So what happens when you've contracted this virus? Can you get it again from what we can tell?
There have been a few anecdotal cases where people have been confirmed positive, and a month later, they feel fine. They think they're negative, and then they later test again positive. So there are 2 theories. The first theory is either they got reinfected, or the virus never completely finished shedding the blood system. Like there's some remaining neurotransmitters or something like that left, some DNA material left behind. So that's still under research. The whole question of immunity is still under research. So I can't give a definitive answer. I can tell you this. With all the other coronaviruses that we do know of, and this is a coronavirus, you usually get some form of immunity once you get it. Even the common cold, you can get the common cold, you're going to have immunity at least for 3 months. Most viruses like coronavirus give you immunity anywhere from 3 months to a year. We have no reason to think this one is different. We just have not done enough research to see how much immunity you actually get.
Sure.
So the answer is it possible to get reinfected? Eventually over time, yes, it is. But how quickly that happens, we don't know.
Let's jump into testing and the vaccine should it come. Testing, can you talk about what the test involves? It sounds like there's a variety of different tests out there.
Yes.
A little bit about that.
Yeah, so right now, the CDC recommendations and the state health recommendations are changing literally as we speak. Remember when we first started, you couldn't get a test unless you actually came from China or had a fever or had a cough. That's all thrown out of the window. Right now, they're virtually testing anybody who pretty much wants to get a test. So if you call your local health department and you have a fever or a cough, whether you've traveled or been in contact with anyone, if you have a fever and a cough or fatigue, you can get tested and they'll tell you where to go. The good news is I've just was working with some of my colleagues because this was a concern for us, where to get testing. They have been setting up multiple testing sites in the community, and specifically in North St. Louis County and the city of St. Louis. So you can actually go to your local health department and find out your testing site in your neighborhood and just call. The other good news is when the test first came out, it took forever to get results. Right now, you can probably go to any testing community in your neighborhood, not go very far. Your tests are usually back within 48 hours now.
Wow.
So and those are what we call the nasopharyngeal swab. So if you go to a testing site, there are two ways you're going to be tested. Either you're going to put a swab down your nose through the back of your throat, which is pretty deep, but it is a nasopharyngeal. And the other swab is just like a throat swab, like if you ever got swabbed for strep throat. Those are the two main tests. The sensitivity and specificity of those tests are very good. So if it's positive, it's positive, and it's negative, it's negative. There's always a little ambiguity, but I think that the sensitivity and specificity is over 90%, which is good for a test.
Is testing free, or is this?
Most of them say, well, right now, depends on the local health departments. From St. Louis County, I don't think they're turning anyone away. They may ask you for your insurance card, or if you don't have insurance, I think what it is they're just asking you so they can figure out how they're going to pay for it if you don't have insurance. But to the best of my knowledge, at the testing site, if you call and they give you an appointment time, you can get screened irregardless of your ability to pay. That's my understanding.
Okay. Are there home tests available?
No. There's some nefarious tests being offered on the internet. Do not buy it. Do not fall for it. There's no home test available that has been approved by any reputable organization.
Okay.
The most reliable testing is what you get at the test centers.
Okay. The question just came in. Is it true that there will be another wave of infection this fall or winter?
It's most likely. Viruses come in cycles, and we are expecting this one to come in cycles also. It may wane a little bit during the summer, we think. We're trying to project. We're not really sure because it looks like we're at the top of the peak, and it should start declining in the next few weeks. And we're thinking our numbers should start declining in about 2 to 3 weeks. And if that happens, that would be great because that's what's happening in China, Italy, and Spain. But all viruses are seasonal, just like the flu. They always come back around. So if this started in the winter of 2019 or late fall, we expect it could come back during flu season. It may not be as strong, it may be a little different, but we expect that it could come back. Now, remember, this is a virus that we've never experienced before. So we're trying to anticipate this off of other coronaviruses. So it's the best guess.
Okay. But hopefully,
I just want to go back. Yeah, but hopefully, it'll come back and we won't see too much of a surge. We'll be a lot smarter as a society.
right.
I do want to step back and talk about, because you did ask me a question about antibody testing, which is very different.
Yes.
The testing we just talked about, where you get your nose and your throat swab, that's what we call diagnostic testing. That lets me know, do I have the disease right now? Okay? Antibody testing is something totally different. This is a test of people who may have been already exposed and have an immune response. I mean, you're immune to it. Hopefully, you're not going to get reinfected. So in order to find out if someone is immune, you actually have to draw their blood because you have to get certain memory cells, IgG, IgM cells, and their T cells to see if their body has been exposed to the virus and if their body is actually making antibodies. And that's what we call an antibody test. Those they're on the brink of doing some of that testing now. The only one I know who has a really good valid antibody test is Quest Diagnostic, and they're not offering it everywhere yet. And you have to actually get your blood drawn, like blood drawn out of your arm. There are some antibody tests around that people are doing where you just get a little finger stick, and those are, we've been actually telling people not to get those because they're not very reliable. and they're hit and miss.
Okay. If we find ourselves exhibiting these symptoms, what do you suggest we do? Is it safe should we go immediately to the hospitals? What do we do if we find ourselves not
Well,
feeling good?
if you find yourself not feeling good, okay, and everybody's symptoms are very different, the first thing I'm going to have you do is call your medical doctor, okay, because it depends on the severity of your symptoms, what you need to do. Let me give you an example. If someone calls me and say, hey, Dr. Gunn, I don't feel well. I know someone who's had COVID-19, or I think I've been exposed. I have a fever and a cough. For the most part, I will always tell them, first, you can go ahead and get your Tylenol, start treating yourself with Tylenol, and then I would send them to a testing site with a fever and cough. They can do a drive-through testing site. But for the most part, we do want people to stay at home. Most people who get the virus will actually do just fine. It'll be like a cold or a bad cold, and that's it. The ones we worry about and we're concerned about are those who start off as a bad cold but get worse as time progresses. This is why I want you to call your doctor first. Because your doctor, once you call them and say, I think I have symptoms, you got to get the test. Your doctor is going to be able to get the results and talk to you about the test and call you on a regular basis to check on you and see how you're doing, like every day or every other day. So let's say for 3 days you do well. On the 4th or 5th day, you're not doing so well, you're not breathing well. They're going to know when it's time for you to get to an ER. You understand what I'm saying? Because you may need supplemental oxygen. You may need other treatment. You may need something a little bit more aggressive.
Okay.
Now, the only thing about the coronavirus is we don't have, quote unquote, a treatment yet that's been proven. So what we do is give supportive therapy. Some people who are having a really difficult time with the COVID-19 may need to be in the hospital because they're dehydrated. So they just may need IV fluids and oxygen to help them get through. And that's something you'll have to work through with your doctor.
Okay. Can you talk a little bit about the mental health side of this? I don't have a specific question, but just what resources are available? How do you see this affecting people on the mental health side of things?
Yes. Everyone's affected. When I say everyone, I mean everyone in society. There's no one who is not going to have a behavioral health who's going to escape this, because it's unnatural for us as humans to shelter in for 14 days. It's stressful enough. Then there's the stress of the economics for those of us who are not working. Then there's the stress of not knowing if you have the disease or if a loved one has the disease and is in the hospital. You can't see them. You can't see how they're doing. And God forbid that it should come to the disease. You can't have those last moments. So there's a lot of stress, a lot of anxiety, and a lot of depression. And no one is immune to this, not even me as a provider. So making sure that you're talking to someone is absolutely key. You could be talking to a friend or a family member. I know there's some, I was going to try and pull up a hotline, but I know that NAMI, NAMI.org, National Association for Mental Health, is an excellent organization. You can go to their website and they will say, resources for COVID behavioral health in your community. Or you can even go to the local health department, or you can call your doctor's office to ask for what services are near you if you think you need a little bit more support. But it is stressful for everyone. It is stressful for children also. I want us to realize it may be stressful for adults, but you have children whose lives have also been interrupted. They're used to getting up, going out into the world just like you are, and seeing their friends and their colleagues. And so they're struggling at home, just being at home, with mom and dad, who may not teach the way their teachers teach, and not being able to see or touch or feel people who've been part of their life for so long, So what we want to do is also be aware as adults that we're under a lot of stress and depression can creep in. But I also want us to be aware it can happen with your children too. Okay, so look for those little odd behaviors in your kids when they're acting out. They're just not behaving, and then you got to kind of intervene, do things to help them get through this. Talk to them, let them know what's going on and why we're doing this, and give them little outlets. I find that, believe it or not, art at home helping them having them draw or color or sketch or do whatever they want to do or write. So because they're having a lot of stress and anxiety just as well.
Yeah. Thank you for that. Have we found any cases of children having COVID?
Oh, absolutely. It is not regulated. It's one of those myths. Only the elderly get it. That is not true. That is not true. Now, a lot of younger people may not be symptomatic, and some people are. It really depends on your immune system. In Detroit, Michigan, a little girl that was 5 years old died. No apparent medical problems at all. And the only reason I say this is because I knew that child. I'm originally from Detroit, so my whole family's there. So she was our third cousin on my mom's side. Completely healthy 5-year-old, was enjoying life in school, just had a little headache and maybe some allergies or a cold that just got worse and worse and worse. And she died. And she was 5.
And it was from COVID.
It was COVID-19.
Wow. I'm so sorry to hear that.
Yeah, but you have people of all ages who are succumbing to this. So no, this is not just something for people who are quote unquote elderly. It affects all populations and all age groups.
And we forgive you for being from Detroit. We forgive you.
You hear that?
You touched on this a little bit earlier, but we have a question about going back to the vaccine. The BBC reported the UK is having human trials of the vaccine. Is this accurate? Have you heard anything about this?
Yes, I have. Actually, we're very happy about that. So to be very specific, it's Oxford University.
Okay.
So in the scientific world, universities are always doing research on viruses and vaccine development. Well, several years ago, about 6 or 7 years ago, we heard that Oxford University wanted to try to find a vaccine for the common cold, which is the coronavirus. And we're like, you're never going to find a vaccine. But they have actually been studying the coronavirus to find a vaccine for 10 years. And then the pandemic came. And the one thing that kind of gave them a leg up was they were already working with other forms of coronavirus. Unlike a lot of people were working with other things. So when this coronavirus came along and they were able to map out its DNA, they were able to move very quickly to do some trials with some of the rhesus monkeys to see if they can come up with a vaccine quickly. So what they did is what we call a phase 1, and that's or early trial with animals only. So they were able to inject a trial vaccine into, I think, about 6 of their rhesus monkeys, and then they waited a week or two. They didn't come out and publish right away because they were nervous. And then what they did is gave the animals the vaccine, waited a while, and then they actually specifically infected the animals with COVID-19 after giving them the vaccine, and none of the animals were sick. And that's important because the rhesus monkey's immune system is very similar to ours.
Okay.
So they're really excited about that phase and passing that phase. So they're going to move to human trials now. And they're trying to get enough participants in the trial. And if they can actually get enough people in the trial and get it started right away, the first thing you got to do is give everybody the vaccine, all the humans. And then once you give them the vaccine, then you have to actually make sure there are no side effects to them, that it's safe and not exhibiting side effects. And then you have to expose them to the virus to make sure that they're immune. And then you have to test their blood over time. Now, this does take time. It's going to take several months, but it's a lot faster than 2 years, 18 months to 2 years, which is what we were looking at if we started from scratch. Which means, theoretically, if they can do this over the next 4 months, we could theoretically have a vaccine by the end of the year. Wow. If the trial is successful. The good news is it's done at Oxford University. When universities develop a vaccine, they tend to be a little bit more humanistic in their patent. In other words, they don't hold the world hostage. So, as opposed to, I'm getting political now. If it was Pfizer, I don't know, we all be in trouble. If it were Pfizer, we all have to be like, oh, okay.
I got you. We got you. Thank you.
No, we're optimistic. I think the findings coming out of Oxford University is very encouraging.
Good. Good. We have a few more questions. Is it true that we should not take our ibuprofen or Aleve as it will make you more vulnerable?
Well, I've heard that rumor, and there have been some papers. I think there was one paper that came out that said that the virus is more prone to a receptor called an ACE2 receptor that is also what the ibuprofens and things like that use. But there's no quantitative proof that that happens, that if you take a Motrin or if you take an Aleve, that it actually gives you the virus. So there actually is no proof. The paper that was written in the Lancet magazine, I actually read it. It was only one paper, and he was trying to find out what receptors the virus was hanging on to. But it's the same receptors for people who take blood pressure. Like if you take losartan or lisinopril, or it's the same receptors as if you take the Motrin one. So I'm not really convinced that taking a Motrin will give you COVID-19 or make you more vulnerable.
Okay.
But more research can be done on it. So what I've been telling my patients, and I had a patient earlier today who said, Dr. Gunn, I said, you can always just use Tylenol. It works just as well.
Okay.
If you had to choose between the two, you could use Tylenol.
And no ingesting bleach, no shining lights, bright lights down your.
Yeah. Okay. So I'm gonna just say, whatever you do, do not. I have to say it. Don't listen to your president. Just listen to Dr. Fauci.
Okay.
He's a scientist that comes on. Listen to Dr. Fauci. What he has to say is factual and true. I don't know what to say about how he came up with inject. No, do not inject yourself with bleach. Do not drink bleach. No disinfectant will cure you. In fact, it will kill you. It really will, immediately.
Okay. I just wanted to clear that up. There could be some adventurous people out there. I just wanted to make sure that we were safe. Someone says, does taking things like elderberry and vitamins boost our immune system? If no, what do you suggest?
Well, a lot of people say that a good immune system is in hand washing and eating healthy is the best defense, which is true. Elderberry specifically. Now, one thing about elderberry, a lot of people push it, and it does have some advantages as far as your immune system is concerned, but you have to be careful with elderberry. Because if not, it depends on who's making it, how you're taking it, and how you're preparing it, because it can be sometimes a little bit more harmful. There are other things out there that are much more safer and proven that boost your immune system. Okay, I'm going to go back, and it's really true. Do you remember back in the day when your parents used to give you cod liver oil?
Yes. Yes.
It's just as good as elderberry and a lot safer.
Really? So Big Mama knew what she was talking about. Huh?
She really did. The other thing is plain old multivitamin, over-the-counter multivitamin, and zinc.
Okay. Now,
the vitamin zinc, Z-I-N-C, over-the-counter.
I can't find that anywhere now. It looks like that's flying off the shelves.
Yeah, because actually zinc is a naturally occurring substance. And one thing zinc has always done in the form of a mineral is it helps boost your immune system. But one thing they found out with the coronavirus is the way, when you see it on TV, you see this ball with those little crowns, the corona. That's why they call them coronas, because they have little crowns on them. Mm-hmm. Those little crowns are what attach when it goes up your nose. But people who have good zinc or high amount of zinc, the zinc in your body breaks those corona caps off, so it can't really attach. It's hard for it to infect you in the presence of a lot of zinc. So a lot of people have been saying supplement your diet or your multivitamins with the zinc. So I would recommend some basic things for your immune. Eating healthy, getting out and exercising also boosts your immune system. This is the worst time in the world to eat things that are fried and fatty. You want to look at fruits, vegetables, things that are high in protein, low in carbs, the things that give your body natural energy. Lots of berries like a raspberry or blueberry, a strawberry. These things are really helpful to your immune system.
Okay. Zicam. Someone asked about Zicam, which has zinc.
Yeah, but there are easier ways to get zinc, like, I don't know, in a multivitamin. Most multivitamins have like 40% of your daily needs for zinc anyway. Okay.
Yeah. I want to open up for any other questions, maybe 2-3 more questions, and then I want to let Dr. Gunn go and be with her family. So any final questions? Can you throw them on to the board? I hope you all have found this very helpful. That I have. Thank you so much, Dr. Gunn. You are amazing. You have a very good way of explaining things that is very palpable. So thank you so much. But are there any final questions? I'm not seeing any final questions as of now. All right. Any last tidbits you want to give us, Dr. Gunn?
Yes. I want everyone to be safe. If you're going to go out there, and if you're just walking around your house or in the yard, you don't necessarily need a mask. But if you're going to go out there and get involved in a market or a store, please wear a mask, protect yourself. Remember, simple, plain hand washing. I know sanitizer is kind of short out there, but hand washing, whenever you see the opportunity to wash your hands, please do it. And be smart. Just be smart about it. I know it's a lot of confusion out here of how states want to open and when they want to open. I'm going to be honest with you, as a physician and as a parent. They can open the movie theaters up tomorrow. I will not go to one. Okay? No, that is not a place to be.
Thank you.
Where you're going to be in a closed environment with a lot of people who are unknown, and you're going to share the same breath and air, especially if you're not protected. Number two, remember, this is stressful for everyone. So remember.
Uh-oh. Oh, what a cliffhanger. Oh,
Right.
oh, she's killing me. All right, we have to get her back on. We have one more question that I overlooked, so I'll be sure to make sure we ask that question. And it's about giving blood. So,
Can you hear me?
okay.
You're back.
Okay, I'm back. I'm sorry. So again, this is a stressful situation. So what you want to do is make sure you do something to relieve stress for you and your whole family, and please include your children. I find out that just simply going out for a walk around the block, if they open the parks, remember to do social distancing, but bike riding is a good, healthy thing to do, or just go out and do some jumping jacks. It's very refreshing, but find a way to relieve stress, okay?
Okay. We have one final question, Dr. Gunn. Someone asked about giving blood. Is it okay? Do you encourage us to give blood?
I think that one of the things I find out, not only giving blood, but people are asking for donations of plasma for people who've already been infected. And I would actually encourage it. Most people, like the Red Cross, who are taking blood and plasma right now, these are very safe and sterile environments. And the reason I am encouraging people, especially people of color, to do it, is that we don't do it enough.
Yeah. Yeah.
And when our parents need blood, or we have a family member who may need that plasma, it is very good that you are able to get a type cross specific to you. So the more people of color we have donating, the better off we are as a community.
Okay. Okay. Dr. Gunn, this has been priceless. Thank you so much. I'm going to just put it out there and ask, can you come back to us in a few months and have another session like this?
I love, that'd be fine. I can do that.
We've made you part of the City Academy family now, so we sincerely appreciate you. You have a wonderful evening. You please stay safe. And same to you all out there at City Academy. We love y'all. We miss you. Stay safe, and you'll hear more from us pretty soon. Thank you, Dr. Gunn.
Thank you all. You guys stay safe. Have a good evening.